Dear students, today we'll talk about a case that is very important and most of the times come in exam. So let's start. We have 44-year-old man, a chronic alcoholic, present to us with a sudden severe epigastric pain radiating to back. This is very important. Sudden severe epigastric pain radiating to back. So he has sudden severe epigastric pain that is radiating to back. This pain is associated with repeated vomiting. This patient is vomiting again and again. And the pain improves on leaning forward. When the patient lean forward, the pain improves. It means the pain decreases when the patient lean forward. So this is again important point in this. So one is this point that is important, and another is this line that is very important. And most of the student will know what is the diagnosis. But let's discuss. On examination, when we did the examination, he is febrile. So he is febrile when we did examination, tachycardic and hypotensive with marked epigastric tenderness. He has epigastric tenderness and guarding. So these features are present in him. We noted the patient and we did examination. We did lab examination and imaging. On examination, we found that the serum amylase is elevated and it is more than 3 times a normal value. Serum lipase is also elevated and serum calcium is low. We also did ultrasound and that showed bulky pancreas with peri-pancreatic fluid. That edema has occurred around the abnormal areas. So what is actually the question is what is most likely diagnosis? They are asking about the diagnosis. So the answers are: number 1, acute cholecystitis, whether it is acute pancreatitis, perforated peptic ulcer, and intestinal obstruction. So you think about this question, I will expose the answer. So this is the case that we discuss, and they are asking about the diagnosis. So first of all, let's see. I have exposed the question. Okay. Now if we see the case, here we have a patient that is 45-year-old chronic alcoholic. He has a history of alcohol. Sudden severe epigastric pain that is radiating to back is most likely with acute pancreatitis. So the answer is acute pancreatitis. He also has a repeated vomiting, which is a feature of acute pancreatitis. And the main feature of acute pancreatitis is that the patient pain improves when he leans forward. He is febrile because he has pancreatitis, tachycardia, and hypotensive. Epigastric tenderness because this pancreas location is in the epigastrium and guarding. Now, serum amylase and serum lipase are elevated because the production is continued, but the pathway to go to the duodenum or small intestine is blocked. So the level of amylase and lipase increase inside the pancreas, and that cause autodigestion of a pancreas. So that is why serum amylase and serum lipase are elevated, and among these, the serum lipase is more specific. But in clinical practice, we mostly do amylase. So serum lipase is most specific, but we still in clinical practice mostly do serum amylase. Serum calcium is also low because here pancreatic enzyme, specifically lipase, digests the lipid into fatty acid, and this fatty acid bind the calcium and cause a process that is called as saponification. So calcium become low inside the serum, and the bulky pancreas with the peri-pancreatic fluid is shown on the ultrasound. So the most likely diagnosis is a acute pancreatitis. Now here also I have written the explanation and main features that are present inside the acute pancreatitis. So we have typical epigastric pain. Epigastric pain radiating to back is the typical presentation, and very high amylase and lipase is again laboratory finding. Alcohol is a major risk factor for acute pancreatitis, and imaging show inflamed pancreatitis, and all the above confirm the acute pancreatitis. So my correct answer is acute pancreatitis. This is very important and most of the time come inside the exam.